Did you know there's another open enrollment period coming for Medicare beneficiaries? We're going to talk about the Medicare Advantage open enrollment period in today's video, and specifically 5 things you need to know about this open enrollment period. If you're new to my channel, my name is Jamie from meetjamie.com. I'm a licensed insurance agent. I help people all over the country understand how the Medicare program works, as well as connect them with the coverage that fits their needs. And so we're going to talk about 5 things that you need to know about the Medicare Advantage open enrollment period. Probably the most important thing you need to know is, when is this? Well, it runs from January 1st through March 31st. And what we're going to cover is these 5 topics. 1, who is this for? So we're going to go over who qualifies to make changes during the Medicare Advantage open enrollment period. In this video, we're also going to talk about what you can do. We're going to highlight the type of changes allowed, like switching plans or returning to original Medicare. Next, we're going to talk about what you can't do during the Medicare Advantage open enrollment period. So we'll talk about specific restrictions to help avoid confusion. Then we'll talk about how to decide whether you need to switch your plan during the Medicare Advantage open enrollment period. And then we'll talk about the timing. So if you make a change during the Medicare Advantage open enrollment period, when will that new plan go into effect? Okay, let's dive into the first section of today's video, which is who can use the Medicare Advantage open enrollment period. So it's very important to remember that in order to use the Medicare Advantage open enrollment period, you must be enrolled in a Medicare Advantage plan starting in January. So in other words, if you're on original Medicare and you're thinking, well, can I switch over to a Medicare Advantage because it's the Medicare Advantage open enrollment? The answer is no. This is specifically designed for people who currently have a Medicare Advantage plan. And so whether you picked a plan during the annual enrollment period in the fall that's just not fitting your needs, or if you didn't get a chance to review your Medicare Advantage plan and make a change, and you currently are on a Medicare Advantage plan in January, this would be an opportunity for you to be able to do that. So what changes are allowed during the Medicare Advantage open enrollment period? So again, this is different than the annual enrollment period in the fall. So as I mentioned, you have to have a Medicare Advantage plan. So one of the things you can do is you can switch to another Medicare Advantage plan. In other words, you go from one Medicare Advantage plan to another. The other thing you can do is you can move from Medicare Advantage back to original Medicare with the option of adding a Part D drug plan. I always want to remind people of this, though, and that is you don't necessarily want to do this switch from Medicare Advantage to original Medicare unless you can also get a Medicare supplement plan. The reason is your Medicare Advantage has what's called a maximum out-of-pocket. And that is basically a cap on what you will pay for medically necessary services with that Medicare Advantage. If you go back to just original Medicare, you introduce that 20% gap in coverage, and you don't want to leave that open. So you can look to a Medicare supplement, see if you qualify before you make the switch to original Medicare. Because if you just make the switch from Medicare Advantage to original Medicare and you don't medically qualify for a supplement, well, now you have a 20% gap in coverage. So you're going to want to strongly consider that. Next, what changes are not allowed? So again, you can't enroll in a Medicare Advantage if you're on original Medicare. Also, Enrolling in a Part D plan, if you're not leaving a Medicare Advantage plan, that includes drug coverage. You can't do that either. And you can't switch between Part D standalone prescription drug plans. Again, remember, the Medicare Advantage open enrollment is designed for people who are on Medicare Advantage. Easy way to remember, it's in the title. So how do you evaluate whether a change is right for you? Well, obviously, it's very similar to the annual enrollment period in the fall. You want to assess your current healthcare needs and costs. You want to verify that your doctors, specialists, and hospitals are still in network. You want to look at, does the plan cover your prescriptions at an affordable cost? And then you can always look for new plan benefits that your current plan may not have. These are things like vision, dental, hearing, fitness programs. You can do all of this on Medicare's website, which is just medicare.gov, and use their plan finder, or consult by consulting with a licensed Medicare agent. Looks like I have a little spelling error there. I missed that in the pre-editing. Next, when will your new plan benefits begin? So your new coverage will start the following month that you enroll in the plan. So let's say, for example, that you enroll or switch in February. Your new coverage for that Medicare Advantage plan will start March 1st. This is also true if you go from Medicare Advantage to original Medicare. So again, just to do a quick recap, the Medicare Advantage enrollment period runs from January 1st through March 31st. It's designed specifically for people who are on a Medicare Advantage plan who would like to switch to a different Medicare Advantage plan, or possibly even go back to original Medicare. That's all I have for you today. If you found this video helpful, again, you can reach out to me through my website, meetjamie.com. And if you do enjoy videos about Medicare, I'm here to help guide you through the process. Please consider subscribing to the YouTube channel, hitting the like button, and of course, if you have other questions about Medicare, you can certainly leave them in the comments below. Thanks for watching. Have a great day.